We're going to start our session now, and I want to thank everyone and welcome you to the Path Outcomes Congress for 2018. We're so excited because we are hearing directly from our service units, facilities, and hospitals for this session. First, there's just a few housekeeping items, then I'll do a quick review of the agenda, and after that, we have a few guest speakers. After our guest speakers, we'll jump right into the facility presentations. I want to introduce you to the PATH team members that are serving as your hosts today and to whom you reach out with any questions throughout the session. I'm your facilitator, Margaret White, along with Francesca Flores. You can find us in chat in the participant list. You can chat to us privately by choosing our name individually, or you can chat to the whole group by using everyone on the chat list. This is also the best way to give us any questions you have for our speakers to answer at the end of their presentations. We want to thank you for taking time away from your busy day to join us, to learn, knowing the demands you have on your time and the time constraints that you face. Thank you for taking the time to join us, to share your thoughts, ideas, and to provide feedback to us. And we want to thank you for being open to the challenges you and your facility and the staff there are facing every day, and putting what you learned into practice. Overall, just what you give every day to make our healthcare system better. Here's today's agenda, and we're going to be hearing first from Commander Glenn from CMS, and then Dr. Sadovich from IHS. And then we have 4 different facilities that are going to be doing individual presentations, and we'll have staff from those facilities doing those speaking. And we're going to hear from them about how they've integrated different LAN topics into their facilities and how LAN and leadership work is being done in their different facilities. First, we will hear from Commander Stephanie Glenn from the Centers for Medicare and Medicaid Services, CMS. Commander Glenn, please go ahead and speak.
Thank you, Mary. Good morning and good afternoon to everybody. I'm Commander Stephanie Glenn, and I've been with CMS for 5 years, and I've just recently moved over. I was at the Innovation Center, and I've just recently moved over to CCSQ to lead up the improvement efforts with this work. I'm not going to take up too much of your time. I just want to take a moment to welcome everybody to the call. I'm really, really excited about hearing what you guys are going to talk about today. We are at CMS really excited to remain in partnership with you and leadership at the Indian Health Service and PATH to continue moving forward on our aims. You guys are doing a lot of great work out there. The other thing I would like to point out and please invite you to is considering to come to our quality conference at the end of January. It's a great venue to and network with other facilities, and we also would really like to hear what you guys are doing. So there's still opportunity to present a poster. So if you've got something that you would like to share with everybody, we would love to see it. And I certainly hope to meet you guys there in Baltimore at the end of January. So with that, I will pass it on to Dr. Sadovich. And I thank you guys again for all the hard work you're doing and taking time out of your busy day to share with us.
Thank you, Commander Glenn. And yes, we do have several facilities that have either applied for posters at the quality conference in January or else as speakers. So you will be meeting some of the staff at our facilities in January.
That's fantastic. Thank you. Looking forward to it.
Great. Next, we'll hear from Dr. Juliana Sadovich from Indian Health Services. Dr. Sadovich, please go ahead.
Good morning or afternoon, depending on where you're located. My name is Juliana Sadovich. I am the Director of Quality Management in the Indian Health Service. I work very closely with our IPC program and with the quality program that we're instituting. The work that PATH has done started as part of the quality framework that was written in and approved in 2016. Most of that quality framework has been implemented, and as we go, it's sort of sunsetting as we move forward with the IHS strategic plan. About a few months ago, IHS leadership and CMS leadership got together and talked about what we were doing with PATH, the kinds of work that PATH was doing, and the kinds of work that we needed to look at moving forward. That effort resulted in a set of aims being developed, and that aims document has been sent out.
Where's my speaker?
Dr. Sadovich, please go ahead.
Okay, I will see you later. It was nice having a conversation with you.
Dr. Sadovich, do you need to hit *6 on your phone to continue?
Can you hear me?
Yes, now I can hear you. Thank you.
Okay. So the aims developed by that collaboration with IHS and CMS are harm reduction, improved compliance and sustained compliance, and improved transitions of care. So those really big aims had about a 5-year deadline, and then we developed some more shorter term aims that we wanted to do, really not so much aims as milestones to help us reach those aims. So PATH will be working with our hospitals and our area offices to start to collect some baseline data regarding the QAPI programs to ensure that our QAPI programs meet the CMS requirements for comprehensive, and that all departments are participating. And they're also going to collect some data on some measures that are in the aims regarding the ED throughput measures of check-in to check-out and left without being seen. There's also some look at discharge planning. Do patients discharged from hospitals have a discharge plan, discharge instructions? Are patients discharged from the ED having patient instructions and discharge plans? So PATH will be working with our hospitals on that. We're very excited about the aims. This represents, I think, a really strategic view of IHS and really opportunity to work in a very proactive manner to focus our efforts on attaining some goals that will really put us in the forefront and help us improve care to our communities. Thank you.
Great, thank you, Dr. Sadovich. And yes, PATH PMs have already started to connect with their facilities and to initiate discussions about the aims and how PATH staff can support the facilities in whatever way that is needed to meet the outcomes and the goals of these aims. So thank you for talking about that today. Now we're going to transition.
Do you have time if anybody has any questions?
Sure, absolutely. We can have people put questions in chat right now. I'll give a few seconds for anyone who wants to ask a question of either Dr. Sadovich or Commander Glenn. Also, if you want to use *6 to unmute your phone to ask a question outside of chat, that's available also. If you do think of a question later, please go ahead and put it in chat. We will have time later in the session to ask these questions. If Dr. Sadovich or Commander Glenn has to drop off, we can always collect those questions and get answers and then send them out to all the attendees. So now we'll move on to our first facility, hospital speaker. This is ACL, Acoma Canyoncito Laguna in New Mexico. And this will be from Carolyn. Carolyn, please go ahead and speak.
Okay, good morning. This is Captain Carolyn McEwen from ACL Hospital in Acomita, New Mexico. And we've participated in the LAN sessions over the course of the year as well as 2017. So we'll just give a brief summary of some of the work that we've done, both through some of the things that the LAN presentations have sort of motivated us to take a deeper look at. So next slide. Okay, so these were some of the takeaways that we summarized through participation, and one was that quality and safety are very linked. So they work hand in hand with each other, and we've always tried to be mindful of that as we've worked through our projects. And then the second point here is that reliable processes are the key. So attempting to build consistent, known, reliable processes throughout the work. And then the link between safety culture and learning culture. So how do we not only get people on board with ideas around safety, but how do we get people excited and engaged about learning so that they can work together and support each other? And then we've worked on multiple projects here as in collaboration with our PATH partnerships and as a result of LAN participation. So one of the things that we started to really think about is what systems do we have and how can we maximize systems that we already have in place? Because we really recognize through some analysis that yes, we have some excellent systems, but they're not always maximized for a variety of reasons. So one of the big projects that we took on was to really look at the website incident reporting system. Although the system has been in place for many, many years, it really wasn't maximized in a way that we could really implement it on all levels in terms of engaging staff through a just culture perspective, by really working the issues that were reported to improve processes and safety. And so we really wanted to maximize it. We also wanted to figure out how we could maximize extracting data out of the system. So that was one. The next thing that we really have worked hard on is not only the hospital QI project. We created a standardized template and reporting structure. So not only is there an overarching quality plan, but there's also departmental plans using again, a standardized template and tools and reporting structure so that that's being implemented on all levels. And then a third project is what we call microsystem meetings, and that's really an effort to meet the principles of the patient-centered medical home. We will be seeking certification for patient-centered medical home in our next Joint Commission survey, which should happen in the next few months. So those meetings were to integrate those principles. And then lastly, we did a hospital-wide survey on perception of patient culture. And we did a lot of data analysis and dissemination of those findings, and then we hope to, as a result of those findings, to implement some initiatives around that. So in terms of what the partnership lended itself for us was, one, we received some data expertise in management, so we were really able to spin up some skills in those areas. We were able to move forward on some just culture perspective and integrate some of those principles into some of the work we're doing. There were a lot of facilitated discussions, so it really got more people at the table and more people talking to each other about some of the projects and some of the issues that we were seeing. And then lastly, quality training. So we have monthly PI committee meetings, so we've integrated some quality trainings into each of those meetings so that we're spinning up some of the knowledge pieces around that. Next slide. And so I know one of the questions was to have a leadership view from more of a cultural perspective. This is a quote taken from a Native person that talks about Pueblo expression. We do primarily service 2 Pueblo tribes, and it says, and you can read it, but it's talking about a spider's web with many threads radiating from the center, crisscrossing, and that it speaks to the idea that the structure emerges as it's made, and that it requires a lot of listening and trust, okay? And that's how you create shared meaning. So, so we felt like we had to summarize our land leadership kind of view, was that here at ACL, we wanted to kind of look at leadership as helping to birth structure, accountability, and create meaning by utilizing some of the principles we learned through the LAN trainings, and such as joy, emotional intelligence, coaching, building culture, safety, and learning as threads that are connected, and that we're emphasizing more crisscrossings through both partnerships formed among staff and across organizations. So that was the view that came out of all this. Next slide, please. Oh, I know, okay. So in one of the presentations, there was a whole presentation around, it kind of brought up this concept of Darth Vader. So the group really appreciated that image, although I see the image is different here, but, and what we mean by that is that Darth Vader sort of spoke to us about really trying to find the barriers, right? To try to find where we were coming up against processes or structures or personalities or whatever that were really preventing us from moving forward. So this slide speaks to this. This is a quote from one of the presentations, that leadership accepts responsibility for enabling others to achieve shared purpose in the face of uncertainty. I think we can all agree that there's a lot of uncertainty moving forward. And then we really wanted to speak to coaching for safety, that we really felt that coaching the staff that we have was a key area we wanted to focus on. And then we also wanted to speak to the proactive involvement. Next slide. And that's it. So thank you so much.
That's great, Carolyn. We had a couple of comments in the chat about, I'm going to go back to it, the analogy for the spider's web, and that leadership view is really inspirational. Can you talk about who might have come up with this, or was it something in one of your committees that you talked about?
Anyone want to make a comment? Oh, well, we were just trying to really think about the year of LAN trainings and think about some of the things that came up and how it really is about a lot of interconnecting. And so then we were trying to think about something that would be culturally relevant, right? So we found this quote. We found a quote that would speak to sort of relevancy and that would be sensitive to the communities that we serve. So this is how this sort of emerged, and it's still emerging. So it's not a done deal is something that we'll present and use as we move forward in some of our work. So it wasn't like a huge discussion. It was just something because the question was posed to us that we said, okay, let's come up with something that's workable that we can work with moving forward. So
it's really an organic type of image, and I think that some of us who do this quality work at the facilities, it does become an organic type of growth that happens and spreads throughout your system. So we're going to go on to the next speaker. Let me just check really quickly in the chat to make sure that there aren't any other questions. So we had a chat from Kara that Leslie Marmon-Silko is a nationally known writer who is from the Pueblo of Laguna, which ACL serves. So thank you very much for that quote and connecting that to your community there. So our next hospital is Blackfeet Community Hospital, and we'll be hearing from Kevin Megan there. And Kevin, please go ahead with your speaking. And if you're on the phone, Kevin, you might have to dial *6 to unmute.
Good morning and afternoon, everyone. My name is Kevin Meehan. I'm the Public Health Nursing Supervisor here at Blackfeet Service Unit. I've been here a little bit over a year. Prior to this, I worked in Wisconsin in ambulatory care, in the ER, and in public health. I made finally a turn back in 2009 and entered into public health full-time. I got real involved with the prescription opioid abuse problem that was all over the country, all over Wisconsin. Back in 2014, I was appointed to the National Governors Association's Policy Academy on Prescription Drug Abuse. I was a co-author of the heroin report for the state of Wisconsin, a few other things, made substance abuse a priority for the Wisconsin Public Health Nursing Association through resolution. So that's kind of my background in public health nursing. I transitioned in 2015 over to Fort Defiance, Arizona, and worked on the Navajo reservation for almost 3 years, and now I've been here since, let me see, it was a year ago, October 1st, that I started here at Blackfeet. Next slide. The LAN Takeaways that I've participated in and what I've tried to integrate here with my staff is really trying to make work fun. Within the group, when I came here, there was only one other nurse here working, and it had to build the department, and the department really was not public health oriented, more of a clinical orientation with immunizations being their primary focus. So with my public health background, I have been moving the group. I'm fully staffed now to help educate the community in health literacy, and by trying to make my staff have fun or enjoy their work, I've kind of been coaching the staff for growth, and have been kind of through our huddles quizzing them on what they see out there as sort of a dashboard of the major issues in the community, and try and sort of coerce their activities towards taking some of that on and taking on ownership of health education in the community. And I'm finding that it's working because they are taking ownership of it, and with that, their work has become more rewarding. And as far as my affiliation with the PATH team, it's been a great experience. Like I say, I've only been here a year, but the wealth of knowledge that they have, the ideas, the creativity, of course, the data, the backup, and their knowledge of Montana itself and the reservation has been really, really helpful for me. So I don't have to start at ground zero. They're able to fill me in on a lot of things that have been going on and a lot of things, a lot of areas that need attention. Next slide. As I said, with leadership, I look at this position through a public health prism. How do we break down barriers and health disparities, and get away from always constantly trying to put out fires, and become proactive, trying to move upstream of some of these issues, the substance abuse issue, the poverty issues that we have here on the reservations, the hopelessness that is run through this community in a lot of areas. I mean, really, it is a very debilitating emotional and mental health problem that you see across the spectrum, the life spectrum, whether it's elders. I go see elders as part of some regular home visits, and those that are in their 80s, they express a lot of disparity about where the tribe is going. There's no opportunities here anymore. The community's dying. So that has an effect on us. We're trying to see how we can address that, and we've been doing it by creating a wellness team with other entities on the reservation and off reservation to help educate the community with health education. And we've been doing monthly events. I'll just give you a couple of examples. We have a really nice skate park here, and this summer we were able to get a group of professional BMX bike riders here, and we were able to get about 15 different tribal entities and community entities to show up and show the people what their resources are, whether it's recovery centers, health decisions on communicable diseases, diabetes education, their church groups that showed up. And it was really oriented towards the youth, trying to help them make good, healthy decisions. And it went over very, very well. We had, like I say, 15 different vendors and several hundred people that showed up through the community. It was really a good event. We've had health fairs here trying to help people connect with Medicare and Medicaid and other health opportunities, dental, vision, all of those real critical health outreach folks that help people connect with their healthcare needs. And coming up in December here, we're hoping it's going to be in December, may end up being January. We have a group that's coming from Billings to help with educating the professionals in the area and also the community at large on dementia. Sort of with the people that we see in public health here, we have a lot of family members that are providing health care. They're the primary care provider for elderly parents, their adult children. We have grandparents who are taking care of their grandchildren. And so there's a lot to be that we could help teach. People that are taking care of their elders can benefit from, again, the resources that are available, but simple things on how to transfer a patient safely or their loved one safely from a couch to a wheelchair, from a wheelchair to a car, all of those CNA activities. So anyhow, I'm getting a little long-winded here. We've been very fortunate with all of the stakeholders helping out on some of these. Again, there is some sustainability problems, but it seems like when we advance sort of a newer topic like dementia, that there seems to be an energy that comes from that, and people start seeing that they can participate in that and help as well. anyhow, making joy in work has really been good to see happen here. My staff has really been picking up the ball. They're moving it ahead. They're enjoying their work. They're enjoying the challenges. And there's a plethora of health disparities here that I don't think we're going to run out of them anytime soon. So there's still a lot to motivate. I keep one eye on burnout, though, because we're working very hard. I'm going to try and write for another nursing position here because we're all basically kind of maxed out. But that being said, it's still fun and still enjoyable. Next slide, please. There we go. I guess I'm done. Any questions?
We did have a question in chat. I think it was related to when you were talking about the dementia education that you're doing. And
Yes.
It was actually more than it wasn't a question. It was more that if you could go back over just a little bit about talking about that dementia education and how patients and families might be involved. I think the audio might have cut off, and they were just asking about that.
Okay, I can't see my chat button here. Oh, there we go. Now I see it.
Yeah, so it just said, as she was saying.
Yes. So there's really quite a need. We're seeing more dementia patients. We're seeing here in the public health department referrals to go and assess the patients who have dementia. So when you have dementia, you have education that we can give the family members on medication adherence, provide them with medication boxes and education on how to load those medication boxes. The problems with dementia itself, educate them on sundowner syndrome and people wanting to wander. And they're also a falls risk, going and assessing the homes for falls. So at this group, at this planned event, we want to address a lot of those things that can exacerbate dementia, but also, tell, you don't want a loved one to trip and break a hip or something like that, or not adhere to their medication, and sort of give them an idea of what the mental health aspects are of dementia. And these caregivers, the family members, it's very, very stressful on them. They don't know. There's not the resources to really, really help. They want to keep them at home. And so what we want to do is try and provide them with some tools to help them deal with their loved ones when it comes to that. Simple skill sets that CNAs have, toileting a patient, how to change a sheet on a bed while the patient is lying in bed, those sort of skills that would help them and help them do it safely. I hope that helps.
Thank you very much. Thanks for giving us those details. We really appreciate that. We're going to move on to our next service unit, which is Red Lake, and we have Angela Tucker speaking today. Angela, please go ahead. Angela, you might hear? There you go. Great. Yes, we can.
Okay, I'm from Red Lake Indian Health Services in Red Lake, Minnesota. I am Angela Tucker, the Safety and Infection Control Officer. During the past year, we have been participating in the leadership meetings and stuff, which has been very, very beneficial for our facility. We kind of learned how to collaborate with other staff in the department. Oh, I'm sorry, next slide. I'm sorry. Okay, there we go. And there were several different projects that came out of the collaborations and stuff. The one that we're working on and still continuing to work on is the medication administration observation process. which combines several different departments: nursing, pharmacy, providers, quality, etc. And we're getting some really good feedback, and people are, and we always emphasize the processes, and it's not just a certain person, which that is beginning there, and people here are beginning to accept that a lot better. They're, to where they're, not being targeted. And this is these classes, these presentations and stuff has helped with that type of changing the behavior for the people here, because as we all know, quality and safety we're in the business of change, and change is always hard. But the presentations from LAN has provided leadership with guidance and content frequency. They have presented scenarios, easy to follow, and all of our staff, and we've increased per meeting with participation, and they find that they can understand these, and they can really relate to a lot of the scenarios, which has been fantastic, because they haven't really had a lot of this type of training for leadership and the staff at the facility. So it's really opened the awareness to leadership that we do need some improvement, and it's to make a better place to work for employees, and it's a better place for the patients, more efficient. Next slide. And then our takeaway for the leadership and stuff is that leadership isn't always just the appointed leaders. There's the leaders that are in the workforce, in the staff, those people that kind of get things done behind the scenes. Those are a lot of go-to people that we like to really incorporate and really nurture to bring them on into that more formal leadership role. It's not about being friends with everybody, which everybody is beginning to understand, because when you're trying to make change, quality and safety people are not everybody's friend, but so you can't be friends with everybody, and people are learning that it's just across the board. There's things that there's things out there to help them in that direction they need to go to and to guide them. The topics that LAN has put out has been very, very effective for the leaders, and some really eye-opening things that to train everybody, even from the leadership, the administration, to be good leaders, active listening skills, etc., information gathering, etc. Next slide. Any questions?
Thank you, Angela. I'm taking a look in chat right now. We did have a question about the aims. So Dr. Sadovich was talking about the aims when she did her presentation earlier. I just want to let participants know we're actually going to hold that one till the end. But if anyone has any questions for the staff at Red Lake or what Angela has talked about, please go ahead and put them in chat. And while we're waiting for people to put a question in or comment in chat, we have one for you, Angela. A good job, and she really liked the leadership perspective, and I certainly agree with that. You talk in this previous slide about being a leader isn't about being friends, and that sometimes you have to take that responsibility for leading the change and directing the staff. So we appreciated that comment.
Okay.
Okay, we're going to move on to, thank you, Angela, and we're going to move on to our next service unit. Thank you. Standing Rock, and we have Denise who's going to be speaking for Standing Rock. If you need to, please dial *6 to unmute your phone, Denise.
Hi, this is Denise. I'm from the Standing Rock Service Unit in Fort Yates, North Dakota, and I'm a nurse here. I've been a nurse here for about 20 years, and I currently am working in the quality and the risk management department. Standing Rock Service Unit is a 12-bed hospital. We're in the rural southern part of North Dakota. We have 4 permanent physicians here and 3 nurse practitioners. We have an ED department, we have optometry, dental, behavioral health, and then we have 5 satellite clinics that we also have here at Standing Rock. Next slide, please. So some of our LAN event takeaways and top learning is that our team valued all of the LAN events. We really enjoyed all of them. We really had good participation from our leadership and our team here. But we felt the emotional intelligence and the culture of safety LAN events assisted us most with our goals for this year, and it was related to improving our culture of safety, our safety culture here. Our team worked with the past project manager to recap learning from each of the LAN events during the follow-up site visits. They would come every month and work with us and reach out with us on the phones throughout the month and answer our questions by email. This time allowed for reinforcement of skills, but also planned for follow-up action items related to the best practices identified during our LAN events. The LANs have been provided excellent leadership development for all of our leaders and including middle management. We found everyone was really engaged, and we tried to, incorporate all of this throughout our whole facility. Most of the time, it was just leadership that came to the LANs, but everyone was welcome, and we tried to incorporate everyone. If it was a topic that someone would be interested in, we tried to invite them and encourage them to come. So, based on a few of our, next slide. Based on a few of the 2017 LAN events, we wanted to improve our safety culture, and our leadership team decided to focus on improving the safety culture within our service unit. So we took on, what we decided to do is we were going to do the culture of safety survey. So in May and June of 2017, we conducted our initial survey. In the fall of 2017, we analyzed our data, and we picked 2 aims to work on for 2018. And then we implemented some improvements and to improve safety culture during this time. And then in September of 2018, we conducted our second culture survey, and we have the next slide, please, and then I'll tell you what we decided to work on. We picked 2 of our aims, and our aims that we decided to work on. The first one was staff feel like their mistakes are being held against them. Our starting point, our baseline, was 39.3%, and our goal was 43% in 2018. The other aim that we chose to work on was hospitals do not coordinate well with each other, and this office is more disorganized than it should be. Our starting point, or baseline in 2017 was 33.9, and our goal was 37% in 2018. Next slide, please. So what are some of the things that we did to work on these aims? We conducted the culture of safety survey throughout the hospital. We encouraged everyone to do it. We promoted it through email, through posters on the walls. I'd walk around and talk to people about it. When we first started this, people were like, what exactly does that mean? They were a little confused about what culture of safety was. And so there was a lot of education, a lot of talking in the hallways and encouraging people to fill out the survey and why it was important. And I think people were really excited when we started this because they're like, yeah, we want to make things better. And yeah, this was exciting and something new. So we had a very good response. Our very first culture of safety survey in 2017, we had like 99 to 100% response. So we're very proud of our service unit for taking this on and wanting to improve and learn. So we are very proud of them. Some of the other things that we did was we adapted a transparency board. We put a quality board on the outside of our conference room. We posted all kinds of data out there. We started the Good Catch program. That was really interesting because people were always giving good ideas for improvements or things that they say could help. And so this was a great way for us to promote them for talking and coming forward. And then also to put them on our quality board and show them that, hey, this person gave us this idea and now we made this improvement. So it was really nice to recognize them, and it also showed that we were working towards making things better and safer for our community, patients, and ourselves. So that was a good thing. We had a team of some leadership here that took on educating all of our staff on culture of safety and incident reporting. They put PowerPoints together, they did a video, and they handed out information, hung up posters, and then we did process maps on what to do with just culture and culture of safety. So that was really nice. So we really promoted it throughout our facility so everybody could see what we were doing. And then next slide, please. So after all that hard work, we have a great slide here. This is one of our most proud slides we want to show you. This is where we ended up. So we had, this is our awesome results. Like I said, our goal was 43%, and we surpassed that and got to 52.2 for our first aim, which is staff feel like their mistakes were held against them. So we are very proud that we were able to do that whole work, all of that work over the whole year. We were able to surpass our goal. So it was really nice to see that. And our second aim, which was hospitals do not coordinate well with each other, and this office is more disorganized than it should be. We were very proud to say that we made it to 51.9% on that. So we were very excited to see how well that this whole culture of safety was embraced by our community and our culture and our people here. So very exciting to see. We hope we can maintain it. So we'll see what next year brings, but it was really nice to see that. Next slide. I think one person did tell me just a little bit about that though, was I had heard, and I think I read somewhere that most people don't have that much success within the first year of culture of safety. So to have that much of improvement and go past our goal was very exciting for us. So we sure shared that with leadership and in our governing board member meetings and stuff. We sure bragged us up for that. And we wouldn't have been able to do it without, how PATH supported us. They came and they coached us, they encouraged us when we're like, oh, do we really want to do this? They were there to help us and encourage us. And they gave us, tools to use. They helped us with developing QAPI education, assisted us with plan development support. And then they also helped us with a lot of the posters and culture of safety tools. And then they would call us every week and tell us how we were doing. And then we'd post those numbers on our wall and show us that everyone could see how well we were doing on our survey and where we were at. So it was very nice to have PATH here to help us through all of our hard work and to help us reach our goal and surpass our goal. So it was very nice that they were here to help us. Next slide, please. So to kind of close things up here, one of the 7 Lakota cultures is a word that we picked, which is called Wulwan. And I should ask for help. I swear I have someone who can say the word perfect. Priscilla, you want to say it? Okay. That word means caring and compassion, love, caring, concern for one another in a good way, especially for the family, the old ones, the young ones, the orphans, the ones in mourning, the sick ones, and the ones working for the people. So this word relates very well to the culture of safety and aligns very nicely with our values, which is one of the 7 Lakota values. And so this is why we chose the culture of safety, a work environment where employees feel safe, valued, and heard creates a safe environment for the patient. So in closing, this was a very good project for us, and it was very nice to see all the work that we put into it and the positive outcomes that we saw. That's pretty much all that I have. The next slide is just a question slide.
That's great, Denise. Thank you very much. I'm going to go back to that slide that shows your results. There were quite a few comments in the chat saying, great job, awesome, what great results. We might have some people connecting to you through your PATH project manager to ask a little more detail on how you did this. And people were very impressed at the progress that you had made with this project. Can you tell us maybe one thing that you think was instrumental in helping make the progress that you did in such a short time?
I think it was our teamwork. We had leadership work on like Arlene, she's here with us today, and Priscilla. They did a lot of just culture. We also implemented that and talked to our community or talked to our staff about that. So that was very instrumental. And I think people were ready for a change. People were excited to yeah, I want to do something to make things better, and I want to be part of it. I think we promoted it very positively and as a way, because everybody wants to make things better and safer. We all know that healthcare is risky, and no one comes to work to harm anybody. So this was a way to promote that and show that we're working towards something. And I think, when we went around, I would go around during the day, did you do your survey? We really want to know what you think. We really want to know where you're how we can make things better for you, for our patients. We always tried to put in there, we're here for our patients and ourselves. And so I think, it was good because all of us, our leadership, we walked around, and the supervisors, we engage like property and supply and housekeeping, and people that don't always get to come to the big table and talk about things. We encouraged everyone in our facility. We educated them and really encouraged everyone to participate, not just the doctors and the nurses, because it seems like so much is so doctor and nurse related topics and work, but this was everybody in our facility. And so I think that's why we had such a great response, is that it was like a whole hospital event. And then, like I said, we had a lot of like little teams going on and lots of conversations between leadership and supervisors with their staff and in their meetings. And so I think that's why we were very successful. And like I said, and people did see that. And I think, we really worked hard on the just culture part, that when you come to us with problems, it's not going to be punitive. We have a process for this. We know nobody comes to work to harm anyone. Things happen. And so I think those were some really good messages that we learned, and we learned them from the LAN event. We learned them from our PATH partners. And so, I'm talking to the thing over there. I'm so sorry. I forgot you're here. You're talking to the speaker. And so I think that was what really was successful for us. Do you guys have anything else? I have my team here with me.
We have.
Yeah. Do you have anything else to add to that? Why we were so successful? Okay.
Another question of how large is the facility?
How large is the facility? We have 130 or 28 employees.
We have 128 at 48, and there's about 35 at McLaughlin, and then we've got Wakbala, Bullhead, and Cannonball health stations.
Right, but we kind of just go out to those health stations. So you could say around 130.
And that includes both clinical and non-clinical departments, correct?
Yes, that's everybody from every department, yep.
That's great. And getting both, like you said, it's not just the nurses and the doctors, it's getting the non-clinical staff, housekeeping, if you have a cafeteria, if you have maintenance, or people that are doing any kind of construction, all those people need to be part of this process. And it sounds like you really brought them together. Very nice. We just had a comment from Deanna, personal plug for my CEO, Betsy Helsel, Catherine Scott, and Dr. Shamahara at CRSU. They're supporting a just culture and rolling it out this year. Exciting stuff. Hopefully we can report on such amazing results soon. And then one more question, did the contract staff participate in the survey? So did you also include, like, maybe if you had traveling nurses or people like that?
Definitely. Actually, some of our traveling nurses, when they came to us with some issues and things they wanted to talk about, some of our traveling nurses actually, and some of our, which were contract staff, they actually were excited to actually be able to be part of our team. They felt like they were really part of Standing Rock when they could come to the table and say, hey, this is something that I saw, and this is something that you should do. And so I think, we embrace them. We could do it probably more. I mean, we didn't do like the housekeeping, the people that deliver housekeeping, laundry. I mean, but most of our frontline staff that work with patients, we tried to include them too. So there might be a few people that we kind of didn't include, but for the most part, yes, we did.
Great, great. We have a few minutes left. I did want to go back to, thank you very much, Denise. Thank you to you and your staff for your presentation. I did want to go back to the question about the aims. So Dr. Sadovich had talked about the strategic aims that came from IHS, and the PATH team will support the facilities on these aims. And there was just a question about how the information around these aims is going to be sent out. And so I don't believe that Dr. Sadovich is still on the line, but that's something that PATH is working on what is, are facilities already collecting this information? And if so, what's the best way to communicate this? We would actually, work with you and your facilities on how this is done. So I think it's a little bit stay tuned. Talk with your project manager from PATH. They'll have some specifics after having talked with you at your facility about these aims. And it might be a little bit individualized because each facility might be doing something a little bit different already on collecting some of this information. So that's the short answer right now for our time here. And then we'll have a longer response that will come through your PATH project manager specifically about this. But we have a few minutes left, and I wanted to thank everyone, Commander Glenn and Dr. Sadovich, Carolyn from ACL, Kevin from Blackfeet, Angela from Red Lake, and Denise from Standing Rock. I think I got everybody. Thank you very much for your presentations today. Very informative. And it takes some time to put these together, and it's a little stressful, a little scary to talk and present these great findings from each of the facilities. And remember that this will be recorded. The PowerPoint will be made available on the healthinsight.org website under PATH. So if there's anybody in your facility that didn't get a chance to watch it or wants to watch this again, that will be made available. So this is our last LAN of 2018, but we will be continuing into next year, into 2019. Spring, possibly February or March. So watch for those invites, connect with your PATH project manager. They'll have all the information. At this point, we're still expecting to do the second Wednesday of each month at about the same time. But we are well open to feedback on if that time or day needs to change. And then we're going to be dropping a survey into the chat here so that you can give us feedback, not just on this presentation, but how have the LAN presentations been helpful to you? What things do you think could be changed? What things do you want to stay the same? And then we're open to topics. What do you want us to talk about in 2019? So please put some information into that survey and chat, and we will send the survey out also through email in a few days. So in case you didn't get a chance to do it right now, or you want to send it to somebody else, they want to give feedback, we'll have another opportunity for you to have feedback on these LANs. I want to thank everyone involved, all our speakers, everybody in the background that is making this happen. And I especially want to thank all of you for taking the time out of your day to participate. We'll keep the Zoom open for a little bit longer so people can go ahead and put their information into the survey. But we're done with our session today. Thank you very much. Everyone have a great day.